Hi guys, my name is Kevin Haugen, and today I'm going to be talking about aneurysms. I'm going to talk you through what they are, different types of them, different risk factors, signs and symptoms, diagnosis, treatment, and an exercise prescription for a specific patient. So, what is an aneurysm? An aneurysm is when an artery wall weakens, allowing it to abnormally balloon out or widen. Most intracranial aneurysms occur between the underside of the brain and the base of the skull, which can eventually leak or rupture, causing life-threatening bleeding. They say there's an estimated 6.5 million people in the United States that have an unruptured aneurysm, which is about 1 in 50 people. When it comes to the different types of aneurysms, there's three main ones, and they are the abdominal aortic, thoracic aortic, and then the cerebral. Abdominal aortic aneurysms are the most common, and they typically happen in the aorta. Given the size and the reach of the aorta, internal bleeding occurs when the blood pressure is increased against the aorta wall, causing it to rupture. For the thoracic aorta aneurysms, they develop in the portion of the aorta that passes through the chest. And like the abdominal ones, they are asymptomatic, which causes them to commonly be confused with heart attacks. When it comes to cerebral aneurysms, they are weakened, bulging vessels above the aorta in the brain, and they are most common in people who are 30 to 60 years old, and they can be extremely fatal when they rupture. And then for the risk factors I have here, smoking is a risk factor, high blood pressure or hypertension. Aneurysms can run in the family. Uh, Age plays a factor, so people over 40 have a greater risk of having them. Genetics, believe it or not, are a big one. Women have an increased chance of having an aneurysm because of their smaller blood vessels. And then race also is a risk factor for aneurysms. For symptoms, they're different between from a ruptured and an unruptured aneurysm. So for an unruptured one, commonly people will get pain above and behind their eyes. Their limbs will go numb. They'll just feel really fatigued or weak. They'll, like a stroke, they'll have paralysis on one side of their face. They'll have vision problems, and their pupils will be dilated. For a ruptured aneurysm, uh, your vision will be severely worse. You could see double. Um, they also can make you nauseous, cause you to vomit. If you have like an extremely stiff neck, you become extremely sensitive to light, and you could also have seizures. When it comes to diagnosing an aneurysm, doctors will typically use an MRI to create images of the brain. They give a really detailed look of the arteries inside your skull. And then for the treatment, there's different options, and they all vary on the size, location, and condition of the aneurysm. Two of the most common ways are the surgical clipping procedure and then the endovascular coiling procedure. For the surgical clipping procedure, they close off the blood supply to the aneurysm, which the procedure, the neurosurgeon would remove a section of your skull uh, to locate the blood vessels that were feeding the aneurysm, and then proceed to place a little metal clip around it, cutting off the blood flow to it. And then for the endovascular coiling procedure, it's very less invasive. The surgeon would insert a catheter into an artery, usually around the groin area, and then threads it through your body to the aneurysm. Once the catheter reaches the aneurysm, they put a soft metal wire through it. It goes into the aneurysm and eventually coils up and will cut off the blood supply to the aneurysm. Some of the long-term complications of the brain aneurysms specifically would be physical and mental fatigue, chronic headaches, having trouble concentrating on things, vision vision problems such as like having partial blindness or having bad peripheral vision. You also can develop cognitive problems like short-term memory, decreased concentration, and perception problems. This brings me to my case study. There's a 61-year-old Caucasian woman presented with an increasing headache for 2 weeks. There's no specific timetable of when these headaches began. Her blood pressure was 130/80, which caused the doctor to order an MRI. The MRI showed that she had a small cerebral aneurysm and was given the option of the endovascular coiling procedure or the surgically clipping the aneurysm. She was then sent home to think about the options before the aneurysm got worse, and then 21 days later, after the first presentation, the aneurysm has ruptured and was rushed to the hospital and left with no choice but to get the aneurysm clipped. So after a procedure like the surgically clipping the aneurysm, the recovery time varies from patient to patient. Once the patient feels that they're ready and the doctor thinks it's okay, they would start the rehabilitation process. Some of the signs that would point them to lead that they're okay to start the process is if they're alert, they're not having seizures, and they're able to concentrate on things for a longer period of time. This recovery process is very long and grueling, so patients may feel sad or angry or can even become nervous, which is all very normal. Seizures can occur. If they do, you should see the doctor to get medication, so no, you don't have any more seizures. The headaches will continue, which is also very normal. And then for my exercise prescription, for someone who's dealing with or going through the recovery process of a cerebral aneurysm, the goal for aerobic exercise would be 3 to 5 days for 20 to 60 minutes. When you start this process, you should start very small and slow. Try not to push them too hard. Start by things like just getting out of bed on their own, walking around their room, and once they feel strong and confident, then gradually increase the walking distance or put them on a stationary bike or water aerobics and just slowly but surely get their strength back. And once the patient and the doctor both feel confident that they can start strength training, the goal would be 2 to 3 days a week, 8 to 10 reps for 1 to 3 sets on each muscle group, each major muscle group. You want to start off very subtle with like resistance bands or very, very low weight. And then, flexibility is also great for people in this kind of recovery to gain back their full range of motion and just make all the exercising easier and make them feel better. And then here I have a website just for more information because aneurysms are very, very common and they're all different between people who have them. So everybody reacts different. Some people recover faster than others, It's really not a very good thing. And then here I have my citations. Thank you.